Thank you, Senator Murray. Secretary Gibson, thank you very much for accepting this interim responsibility. You're a brave and courageous man, and while I'm encouraged by some of the serious steps you've taken, I'm still not satisfied. We have tremendous problems, as indicated by the letter from Special Counsel Lerner to the President of the United States, from which I want to quote one paragraph. I remain concerned about the Department's willingness to acknowledge and address the impact of these problems, meaning the whistleblowers' problems, may have had on the health and safety of veterans. The VA, and particularly the VA Office of Medical Inspector, has consistently used the term, and I quote, harmless error as a defense, where the Department acknowledges problem claims patients have been unaffected. This approach has prevented VA from acknowledging the severity of systematic problems and from taking necessary steps to provide quality care to veterans. And the letter goes on to delineate specific cases where veterans' health suffered because of the agency looking the other way. I have become personally convinced that this begins and ends with a failure of senior leadership in the VA for years to overlook or to look over the manipulation of numbers, to make things look better than they really were, to hope that Congress wouldn't come and look. I think Congress is partially to blame for not coming and looking enough. You know, I learned when I was raising my children that if parents come in every now and then open the bedroom door and look inside, you have a better behaved kid than if you never look inside. I think some of the departments of the VA are exactly the same thing. And the pervasive culture of cooking the books for personal benefit, such as pay raises, is absolutely inexcusable. Lastly, I hope in your remarks, which I'm looking forward to, you'll address how the memo that was written by Mr. Schoenhard in August the 26th of 2010 that delineated specifically many of the problems we are now discovering. This was 4 years ago. How a memo to senior VISN leaders across the network and to senior management could have gone totally unlooked at by anybody in the VA, and the problems that we're now trying to fix lasted 4 more years within the VA because there was a culture of just looking the other way when there was a criticism or there was accountability in place. So while I appreciate very much your willingness to come forward as a citizen and take on this interim responsibility, and I appreciate the steps that you've made, I am not satisfied yet that the VA's culture is any different than it has been, and we're going to have to see to it the culture of the VA changes, and we have accountability from top to bottom, but in particular in the senior leadership and management of the Veterans Administration and the Veterans Health Care. And I'll now yield to...